Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How to find relief for endo belly, or belly distension, is a term describing moderate to severely painful bloating from endometriosis lesions, comorbid conditions, or surgical complications. Endo belly symptom flare-ups can happen any time in the menstrual cycle, making them unpredictable. /r/n/r/n If you have unbearable pelvic pain, are without a diagnosis, or are in between surgeries, go to the hospital. Experts also say that if any of the following apply to you, book an appointment with your healthcare provider /r/n/r/n/Aflo Images, Getty Images/r/n/r/n Not everyone with endometriosis will experience symptoms. Those who experience symptoms can vary from moderate to severe. Some people may say they feel like they look 6 months pregnant. This physical change may be particularly challenging for people experiencing infertility, a common symptom of endometriosis. /r/n/r/n Endo belly symptoms can interfere with many aspects of someone's life, including their work and social life. One common symptom is feeling pain, pressure, and tightness in the lower belly. /r/n/r/n This pain may worsen. /r/n/r/n Endometriosis bloating or endo belly isn't exactly bloating, it's chronic abdominal swelling caused by endometriosis. It can also be caused by comorbid conditions and surgical scar complications from surgical sterilization or cesarean sections. /r/n/r/n Endo belly and bloating are different. Bloating is when your gastrointestinal, GI, tract fills with air or gas. It is a symptom caused by certain foods, lifestyle choices, or GI conditions. /r/n/r/n Symptoms of endo belly like bloating and pain while having a bowel movement overlap with many GI conditions. There is also a known link between endometriosis and comorbid conditions occurring at the same time, GI conditions. /r/n/r/n One large-scale study published in 2023 found people with endometriosis were twice as likely to have comorbid irritable bowel syndrome, IBS, and nearly 1.5 times more likely to be diagnosed with gastroesophageal reflux disease than those without endometriosis. /r/n/r/n Comorbid GI conditions include /r/n/r/n It is a myth that endo belly is caused by endometriosis lesions bleeding each month with the blood having nowhere to go. If this were true, it would be a severe and immediate medical emergency. The fact is that endometriosis lesions do not always bleed. Endometriosis lesions are not like the lining of the uterus, endometrium, which does bleed each month. The two are similar but different. Endometriosis lesions may cause irritation and inflammation in surrounding tissues leading to bleeding, but bleeding may also occur without lesions on the bowels. /r/n/r/n If you're experiencing endo belly and looking for relief, self-care can help deflate and manage pain. Experts suggest trying over-the-counter pain relievers such as /r/n/r/n Experts also suggest the following self-care strategies for endo belly and pain relief. /r/n/r/n Severe bloating during an endo belly flare can make feeling comfortable in clothing challenging, especially when materials don't stretch. /r/n/r/n More comfortable clothing options during a flare-up may include /r/n/r/n Even when self-care helps reduce pain and bloating, you may want to consider consulting with a healthcare provider about medical and surgical treatment options. Though there is no cure for endometriosis, treatment may make the condition and associated symptoms more manageable. /r/n/r/n Medical options include hormonal birth control, the first line of treatment for endometriosis. Birth control for endometriosis works best in cases in which pain and symptoms are not severe. Medications that cause temporary menopause are another medical option. /r/n/r/n surgical treatments may be necessary in cases of severe symptoms, fertility challenges, or when self-care and medical treatment are not providing enough relief. Laparoscopic surgery for endometriosis is a minimally invasive surgery in which a surgeon makes a small incision and removes endometriosis patches, lesions, adhesions, or scars. /r/n/r/n If you've tried everything, and nothing seems to improve your endo belly symptoms, you may feel discouraged and unsure about the next steps. You may want to consider additional professionals or treatments to consider, such as /r/n/r/n diet cannot cure endometriosis, but reducing or removing foods that cause bloating may help with comfort levels. These foods include certain dairy products containing lactose and certain carbohydrates including fruit sugar, fructose. /r/n/r/n Endo belly is severe lower abdominal swelling caused by endometriosis. Comorbid conditions include gastrointestinal diseases and disorders. Deflating and reducing endo belly pain comes down to self-care, over-the-counter pain relievers, medical treatments like birth control, and surgical treatments to remove lesions, adhesions, and scarring where necessary. If symptoms are still interfering with your social and work life, consult with professionals. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.